In this section, we will go through the bones of the foot. The human foot is divided into three parts: the forefoot, the midfoot, and the hindfoot. Now present among the mid and hindfoot are the tarsal bones, a group of 7 bones that are irregular in shape and make up the ankle region. The word tarsus is associated with these bones. First, we will talk about the tarsal bones. The tarsal or ankle bones are 7, and we have divided them into 2 rows. The first one is the proximal row, and the second one is the distal row. The proximal row includes 2 bones, the talus bones and the calcaneus bone. The highlighted bone here is the talus bone, and this is the calcaneus bone. In the distal row, there are 4 tarsal bones lying side by side. From the medial to the lateral side, these are the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. The 4th bone in the distal row is the cuboid bone. Another bone, the navicular, is interposed between the talus and the 3 cuneiform bones. In other words, it is interposed between the proximal and distal rows. You can remember the names of these tarsal bones with the help of this mnemonic. The circus needs more interesting little clowns. The capitalized words are the ones you should focus on. Here, T is for talus. C is for calcaneus. N is for navicular. N is for medial cuneiform. I is for intermediate cuneiform. L is for lateral cuneiform. And C is for cuboid. Moving on, let's look at the metatarsal bones. These 5 bones are the metatarsal bones. The bones of the distal row articulate with the metatarsals. Since the navicular bone does not articulate with the metatarsal, that's why it is not included in the distal row. Now let's go through the joints and articulation of these bones individually. You can clearly see the tibia and the fibula bone, the talus bone. The talus bone articulates superiorly with the tibia and fibula. Other than its articulation with the tibia and fibula, the talus also articulates with the navicular bone anteriorly. Inferiorly, it also articulates with the calcaneus, as you can see here. So, we can say that the talus bone forms 3 articulations: superiorly with the tibia and fibula, anteriorly with the navicular bone, and inferiorly with calcaneus. Now let's look at the calcaneus bone. This bone has 2 articulations. Superiorly, it articulates with the talus bone. Anteriorly, it articulates with the cuboid bone. The navicular bone also has 2 articulations. Posteriorly, it articulates with the talus bone, and anteriorly, it articulates with the 3 cuneiform bones. Similarly, the cuboid bone also has 2 articulations. Posteriorly, it articulates with the calcaneus bone, and anteriorly, it articulates with the 4th and 5th metatarsal bone as highlighted here. The 3 cuneiform bones also have 2 articulations. Posteriorly, all 3 cuneiform bones articulate with the navicular bone, and anteriorly, the medial cuneiform bone articulates with the 1st metatarsal. The intermediate cuneiform articulates with the 2nd metatarsal, and the lateral cuneiform bone articulates with the 3rd metatarsal bone. Now that you know about the articulation of these bones, let's look at bony landmarks of the bones of the foot. So first, let's begin with the talus bone. This is the talus bone, as you can see here. The talus bone has the head, neck, and the body. This is the head. This is the neck, and this whole part here is the body of the talus. If you look at it from this angle, you will be able to see the trochlea of the talus. The trochlea of the talus is a convex articular surface for articulation with the tibia and fibular bone. Two tubercles can be seen in the body area of the talus. This one is the medial tubercle of the talus, while this one is the lateral tubercle of the talus. Something you should remember about talus bone is that it transmits the weight of the entire body from the legs to the foot. The talus bone, the second biggest of the tarsal bones. It has the highest proportion of its surface area covered by articular cartilage of any bone in the human body. And unlike most bones, the talus bone does not have any muscles attached to it. Moving on to the next bone, that is the calcaneus. If you look at the calcaneus closely, you can see the calcaneal tuberosity here. Looking at its inferior surface, here is the medial process of the calcaneal tuberosity, while this highlighted part is the lateral process of the calcaneal tuberosity. If you look at the lateral aspect, you can see a ridge-like structure. This is the peroneal or fibular trochlea. On the medial aspect, there is a structure called the sustentaculum tali. The calcaneus bone is also called the heel bone. It is the largest of the tarsal bone. Then we have the bones in the distal row. The navicular bone has a tuberosity, as shown here, on the medial and inferior aspects, while the cuboid bone has a tuberosity on the lateral aspect. If you look from the inferior view, these two tuberosities are opposite to each other. Also notice in the cuboid bone there is a groove. This groove is for the fibularis longus tendon. The three cuneiform bones, they are wedge-shaped bones. The medial cuneiform has a large kidney-shaped facet on the distal surface for the base of the first metatarsal bone, with its hilum directed laterally. The intermediate cuneiform has triangular articular facets at the proximal and distal surfaces. The lateral surface is marked by a vertical facet along its posterior margin. This facet is for the lateral cuneiform bone. And lastly, the lateral cuneiform has a triangular facet in its upper two-thirds for the navicular bone. The lateral surface is marked in its posterior part by a triangular or oval facet for the cuboid. Let's move our discussion toward the metatarsal and phalanges. These bones form the tarso-metatarsal joints. It is the joint formed between the tarsal and metatarsal bones. There are 5 tarsometatarsal joints in the foot. The first tarsometatarsal joint is in between the medial cuneiform bone and the first metatarsal bone. The second tarsometatarsal joint is between the intermediate cuneiform bone and the second metatarsal bone. Third joint is between the lateral cuneiform bone and the third metatarsal. The fourth and the fifth torso-metatarsal joint is in between the cuboid bone and the fourth and fifth metatarsal bones. Just like the metacarpal bones of the hand, the metatarsal bones have a base, body, and head. Each of the metatarsal bones forms the metatarsophalangeal joint. This is the joint between the metatarsal bones and the phalanges. In each phalanx, there are 3 bones, except the first phalanges, which have 2 bones. The first bone in each phalanx is called the proximal phalange, and the last bone in each phalanx is called the distant phalanges. The phalanges that are between the proximal and the distal are called the middle phalanges. Now, remember there is no middle phalanx in the first phalanges of the foot. Since this is the toe, and the toe only has 2 bones, the joint that is formed between each phalanx bone is called the interphalangeal joint. There are 2 interphalangeal joints in each pharynx, except the first phalanges. which has only one interphalangeal joint. Just like the metatarsal, each phalanx has a base, body, and head. We will now go through the muscular attachments of the bones of the foot, starting with the talus bone. As mentioned before, talus has no muscular attachments. For stability, ligaments do attach to it in various directions. The anterior and posterior talofibular ligament provides stability to the ankle joint from the lateral side. And on the medial side, the talus bone is held by a massive ligament named the deltoid ligament. This ligament attaches not only to a broad area on the talus, but also to the bones below and in front. As I have told you about the huge size of deltoid muscle, let's discuss its parts. So first we have tibio-navicular ligament that is attached to the medial malleolus of the tibia to the navicular bone. Then tibio-calcaneal ligament that attaches the medial malleolus of the tibia to the calcaneus bone. Then we have tibio-talar ligament attached to the medial malleolus of the tibia and connect it to the talus bone. You can remember the names of all these ligaments with the help of a mnemonic. Just remember the sentence: alive people carry too many thoughts to dance. Here the letter A is for anterior talofibular ligament. P is for posterior talofibular ligament. C is for calcaneofibular ligament. T is for tibio-nasivular ligament. Second T is for tibio-talar ligament. Another T is for tibio-calcaneal ligament. And D is for deltoid ligament. Moving on to the next bone is the calcaneus bone. The calcaneal sulcus is the attachment site for interosseous muscle, talocalcaneal, cervical ligaments, and distal to the posterior talar facet, a non-articular area is present on the calcaneus bone. It provides the attachment for the extensor digitorum brevis, the main band of the inferior extensor retinaculum, and the stem of the bifurcate ligament. If we look at the medial process of the calcaneal tuberosity, there is a prominent medial margin to which the flexor retinaculum is attached. And focusing on the lateral process, abductor digiti minimi is present there. Abductor hallucis and flexor digitorum brevis muscle are also present there. A rough region is present between the medial and lateral processes. This region provides an attachment site for the plantar ligament. The plantaris muscle is attached just near to the calcaneal tendon. The medial margin of the sustentaculum tali provides attachment for plantar calcaneo-navicular ligament and short and long plantar ligaments. On the margin of the sustentaculum tali, we can find the attachment site for the tendon of flexor digitorum longus. The large medial head of the flexor accessorius is attached distal to the groove for flexor hallucis longus. The navicular bone has navicular tuberosity to which the tibialis posterior muscle. Moving to the lateral side of the navicular bone, we can find the plantar and dorsal cuboidionavicular ligaments and cunenavicular ligament that join the bone to the three cuneiforms. The dorsal surface of the navicular bone attaches to the neck of the talus with the help of a broad and thin dorsal talonavicular ligament. The plantar calcaneonavicular ligament is attached near the proximal aspect of this bone. You can remember the attachments at the navicular bone by thinking about 3 chairs and 2 tables. As shown here, there are 3 ligaments that start with C, and 1 muscle and 1 ligament that starts with the letter T. On the cuboid bone, only 1 ligament is attached, which is the interosseous ligament. Lastly, we have the 3 cuneiform bones. On the medial cuneiform bone, 2 muscles are attached. There are the fibularis muscle and the tibialis posterior muscle, as shown here. A muscle called the tibialis posterior is attached to the lateral surfaces of the intermediate and the lateral cuneiform bones. Flexor hallucis brevis attaches the cuboid bone to the lateral cuneiform bone. You can easily memorize the names of these muscles with the help of this mnemonic: 4 to the floor, where F stands for fibularis longus. T is for tibialis anterior. Second T is for tibialis posterior. And F is for flexor hallucis brevis. That is all about the bones of the foot. In fact, we have just reached the end of a very long lecture. You can download the PDF file of this lecture for your ease, so whenever you need to revise any of the bone features of the lower limb, you can just go through the PDF notes quickly.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.